Angelman syndrome is an intricate disorder. The primary area affected is the nervous system, which can cause intellectual disabilities, slowed development, seizures, and problems with movement and speech. Some developmental signs of Angelman syndrome can be detected as early as 6 months. Trouble with speech as well as trouble walking are also early indicators. Most of the signs and symptoms for Angelman syndrome appear during early childhood. Weekly physical therapy and careful monitoring of the child's sleep patterns are necessary to keep your child healthy. While children with AS are typically happy and smiling, you must also be patient, for they also show signs of hyperactivity and a short attention span. Diagnosing AS usually happens through genetic testing. Angelman's typically isn't diagnosed at later ages. Some physical manifestations of Angelman syndrome are light-colored hair, fair skin, smaller heads, and an abnormal spine curvature, or scoliosis. While there is no cure for Angelman's, the average life expectancy of each person affected is roughly the same as someone who doesn't have AS. A loving and caring parent is usually the best medicine for a child diagnosed with AS.
Angelman syndrome is a pretty rare form of defective genetic imprinting. Genetic imprinting, for those who aren't too sure or need some clarification, is when the appearance of the child depends on a specific chromosome from either the mother or the father. So when defective genetic imprinting occurs, gene expression is suppressed. For the case of Angelman syndrome, it is mainly concerned with the genetic imprinting of the ubiquitin protein ligase E3A gene, also known as the UBE3A gene, on chromosome 15. Here is a picture. About 68% of the cases of Angelman syndrome is caused by the deletion of the UBE3A gene on the Q12 band of chromosome 15. Normally, a person would inherit 2 copies of this gene, one from each parent. Though both copies are active throughout the body, usually only the copy from the mother is active in our nervous system. Though UBE3A's exact role in our nervous system is unclear, it is highly thought to play a critical role in the development and normal function of our nervous system. Another gene that gets deleted along with the UBE3A gene on chromosome 15 is the oculocutaneous albinism 2 gene, also known as the OCA2 gene. This gene produces a protein that produces melanin, which provides our skin, hair, and eyes their color, and also plays a role in normal vision. Due to the deletion of OCA2, it causes people with Angelman to have unusually light-colored hair and fair skin. A small percentage might even have characteristics similar to albinism due to the fact that the OCA2 from their fathers is non-functioning as well. Though the deletion of the UBE3A gene is the most common, there are 3 other lesser-known causes of Angelman syndrome. About 13% is caused by the mutation of the UBE3A gene, about 6% is caused by the defects of the imprinting center on the mother's genes, and about 3% are caused by the presence of 2 normal number 15 chromosomes, both from the father and none from the mother. Considering the fact that there's usually no genetic history of Angelman syndrome within a family, researchers are still baffled as to what specifically causes these genetic changes that result with Angelman. Fortunately, due to government funding for research and a group of dedicated volunteers known as FAST, which stands for Foundation for Angelman Syndrome Therapeutics, we are closer to a cure. Recent research actually has suggested that restoring functioning UBE3A proteins into the neurons of those affected with Angelman have led to improvements of their learning defects and movement disorders and balance, and hopefully all these positive signs will one day lead us to a cure. For more information, you can always go to cureangelman.org.
Knowing that a child has Angelman syndrome can help the parents find needed emotional and financial support as well. Finding it out can be overwhelming. Parents may not know what to expect and may worry about how to care for the child with medical concerns and developmental disabilities. There are resources that can help. Parents should work with a team or consider a support group. They should find a team of doctors or therapists that would help them with the important decision that they will have to make for their child's care and treatment. To consider a support group, each family and each child with Angelman syndrome is different, but connecting with other families of the same problems may help you feel less alone. Some of the support organizations are Angelman Syndrome Foundation, National Institute of Health and Child Human Development, Epilepsy Foundation, and the Art of the United States. Some of the medical issues include unstable tear gait, absent or diminished speech skills, excessive laughter, or unusually happy. Some patients may develop epilepsy and have problems with their balance. Parents should deal with these medical issues by providing physical therapy and adaptive devices to support their balance and gait. And lastly, speech therapy is recommended for language problems.
This will be the section on a child or a patient with Angelman syndrome and how they will do in regular life and at school. Being a child with Angelman syndrome may seem like a life without worry, but on the inside of a generally happy demeanor, a lot of problems seem to affect the daily life of a patient. Immediately after birth, these children appear to be normal and lead a normal infant life, but often only have feeding problems, so the child may seem normal at first. During the 6th month, we start to notice developmental delays all the way until 2 years old, including very frequent smiling, laughing, and uncontrollable happiness. This may not seem all that bad until seizures start taking place between 2 and 3 years old. When a normal child should start talking, an Angelman child will not use any words at all. The child will also have a small-sized head and will not walk properly. These children need a lot of help walking, communicating, and special assistance when it comes to seizures. In school, Angelman children can't control their hyperactivity and frequent laughter and cannot communicate properly with other people. Such behaviors may cause other children to laugh at him or her, call him or her names, and exclude him or her. We must understand that Angelman children can't understand us better than we think, so it's important not to make the child feel bad or tease him or her. After all, they can't control the way they're acting. Seizures are also very likely in this disease, so the teacher must understand that if this happens, that they need to provide the proper care him or her needs, which can involve a school nurse or a trained medical assistant. Unfortunately, there is no specific therapy or cure for this syndrome. Doctors can help with treating seizures and making sure the child is okay, and physical therapists can give the child care to walk as best as he or she can. Medication can be given to help the seizures. There is no long-term life delay, and they can often live normal lifespans. The extent of this disease is mainly neurological. With communication and behavioral therapy, more mild cases can be helped, but generally there is no cure for this disease. Thank you.